That don't know maybe about the Tunisian Revolution. That's why I'm going to show you a short video clip that sums up what happened during the Tunisian Revolution 2011.
President Zine Ben Ali has ruled Tunisia since 1987 with an iron fist. On December 17th, in Sidi Bouzid, 300 kilometers south of Tunis, the 26-year-old Mohamed Bouazizi set himself on fire after a policewoman confiscated his cotton produce, thus leading to waves of protests, mainly in Sidi Bouzid and its neighbor cities. In an attempt to quell the unrest, President Zine Ben Ali visited Bouazizi in hospital on the 28th of December 2010. Bouazizi died on the 4th of January 2011. The lethal combination of poverty, unemployment and political repression has resulted in protests spreading all over the country. Tunisian security forces used a significant amount of repression. 238 were dead and 1,207 were injured.
فالكفاء عنفا وأعطيت تعليمات كذلك وزير الداخلية وكررت اليوم نأكد يهزي من اللجوء للكرتوش حي الكرتوش مش مقبول.
On January 14th, thousands of people demonstrated in front of the Interior Ministry. The same day, Zine Ben Ali officially resigned after fleeing to Saudi Arabia and 23 years ago.
So 238 were dead, 1,207 were seriously wounded. This was the official aftermath of the Tunisian Revolution according to our Ministry of Health. But certainly, serious wounds refer to physical injuries, to injuries that were palpable and visible. Nevertheless, very few care to mention psychological traumas, psychological injuries, although resulting in actual wounds, although neither visible or palpable. And that's why we wanted to answer this question. The Tunisian Revolution, which psychological aftermath? And that's why we carried out a cross-sectional study involving all patients who first presented at the outpatient clinic in Ramsey Hospital with psychiatric symptoms linked to the Tunisian Revolution. So between January 15th and October 15th, 2011, we only included patients who were symptom-free before the revolution and who later developed psychiatric symptoms they attributed to the events of the revolution, and diagnoses were made according to the DSM-4 criteria. So here is the first result. So the first result we had is a significant increase. A significant increase of 16% in the total number of consultants during the period between January 15th and October 15, 2011 by comparison with the same period of the previous year. So among those 2,148 new patients who consulted during the period from January 15th to October 15, 2011, around 5% had disorders linked to the revolution. That's to say, we had a sample of 107 patients with disorders linked to the revolution. Now, let's take a closer look at the socio-demographic and clinical profile of our population. So, first result, about 3/4 of our sample were male. So, this is in contrast with the usual sex ratio at our department, which is about 1.04. So this is also in contrast with the results of most studies that show a sex ratio less than 1. In fact, females tend to be more exposed to repeated traumas, tend to be tend to have more commonly a history of depression or anxiety, and females tend to express easily their anxious or depressive symptoms. So all these explanations are given to explain why females are often more involved and more concerned by post-traumatic psychiatric disorders in general. So in our sample, the high proportion of males could be due either to the high proportion of agents of order. We'll see that later on. So more than 1/3 of our patients were agents of order, and all males in our sample. And then also by a special social background, because in Tunisia it's certainly more stigmatizing for women than for men to consult a psychiatrist, and especially in Razi Hospital, which is the only psychiatric hospital. So the mean age was also quite young, 40 years, and although most studies reported that old age is a risk factor for developing a post-traumatic psychiatric disorder. So why this young age in our population? Probably because of the demographic features of our country. So in our country, the mean age is 25.4, and of course also probably because of the crucial role played by the Tunisian youngsters during the revolution, and the mean age of the casualties, of the physical casualties, was 30.8. So here is a graph that shows the distribution of our population by professional category. So here is our study population, and here is our usual population. And the most significant result is that we have a high proportion here of agents of order, around 36%. So what are the chief complaints in those patients with revolution-related psychiatric disorders? Anxiety was the most prevalent chief complaint, followed by depression, sleep disturbances, behavioral disturbances, and then other psychiatric complaints were also observed. So here is a graph that shows the variation of the number of patients consulted for the first time according to the date of their first visit, and you can see a peak here around 1 month after the main events of the Tunisian Revolution. What about the traumatic events that triggered these psychiatric disorders in our sample? So here's a table that shows the traumatic events in agents of order, and as you can see here, most important traumatic events, most reported traumatic events, were death witness, arrest and or aggression by soldiers, as well as assault on workplace. As for civilians, so most reported traumatic events were the following: death witness, assault on workplace, and bereavement. Well, we can also say that around 1/3 of civilians did not report particular traumatic scene, but they attributed all their symptoms to a feeling of insecurity and uncertainty due to the revolution events. So, but now, what were those post-traumatic disorders? So here is the table that sums up the different diagnoses we made. So you can see that there are many different psychiatric disorders in our sample. So most prevalent ones were PTSD, post-traumatic stress disorder, major depressive disorder, and adjustment disorder. But you can see virtually many types of other anxiety, mood adjustment, and even psychotic disorders in our sample. So this is important because most similar studies following armed conflicts, natural disorders, and uprisings were limited to PTSD cases, and almost all studies focus solely on PTSD. Description of other post-traumatic disorders remains quite limited, even though PTSD would represent only a modest proportion of such disorders. So this study emphasizes the diversity of mental disorders that can occur following a trauma, in this case a man-made disaster. So moral suffering, chronicity, complications, leave prescriptions, professional reclassifications. So all these elements lead to the high cost of post-traumatic psychiatric disorders. Therefore, specific measures are to be taken. First of all, screening for post-traumatic psychiatric disorders to ensure early diagnosis and management. So we have to screen not only for PTSD, because most studies recommend screening for PTSD. We have to screen for other psychiatric disorders. Then we also ought to establish an adequate treatment plan. Such a plan should provide adequate pharmacological, psychological, and or social interventions as needed. And then we ought to optimize the pharmacological and the psychotherapeutic treatment based on the latest guidelines. And finally, we should enhance the training of mental health professionals in the field of stress and psychological trauma. So thank you for your attention.
Very much. I want to thank all of you for attending. I want to thank all of the participants for great presentations and also staying within our very strict timelines.